A very good afternoon, distinguished guests, Dr. J.S. Bhamra, keynote speakers, Dr. Sanjay Sood, Dr. Sushil Rana, chief guest in absentia, Dr. K.K. Talwar, our esteemed panelists, Mr. Pavan Chaudhary, Mr. Vaibhav Tiwari, Mr. Gautam Khanna, Dr. Ord Sandberg-Kopp, Mr. Hitpreet Khan, and Dr. Mandeep Singh from Thapar University. Participants, I welcome you all to session 4 of day 2 of the International Summit, ATMANIRBHAR BHARAT, India as a Manufacturing Hub for Global Health. The topic for this session is use case studies of why and how telemedicine will outlast the pandemic. So the key points to be deliberated upon in this session relate to how over the last few months, hospitals have cancelled and eliminated elective procedures and physicians have restricted physical access to their practices. The pandemic has prompted a broader adoption of telehealth, allowing patients to see the doctor for ongoing care of chronic conditions. This new pattern of digital engagements is likely to continue and to increase the frequency of consultations, thus deepening the doctor-patient relationship. The key points to be discussed are why and how telemedicine is serving as a boon in handling the pandemic, what are the advancements in user-friendly software as well as medical device-based hardware. I take this opportunity to introduce our presiding expert, Dr. J.S. Bhamra, Chairman of the British Association of Physicians of Indian origin. Dr. Bhamra is a senior consultant. He's a psychiatrist in Manchester, honorary reader at University of Manchester. He has also served as medical director at Manchester Mental Health and Social Care Trust. He is director and council member of British Medical Association, trustee of LMCP Charity for Disadvantaged People, African and Caribbean Mental Health Services. He is the proud inventor of Metabolic app for smartphones. Dr. Bhamra has published over 40 papers and 100 press articles. He has received numerous awards for services towards mental health in Manchester, including Professional Excellence from Asian Light, to name a few. I welcome you to the session, sir.
Thank you very much. Thank you. Can you hear me?
Yes, sir, we can.
Great.
Please allow me to introduce our keynote speaker, Dr. Sanjay Sood, who is Associate Director and Head of Department, Health Informatics at the Center for Development of Advanced Computing, or CDAC. Dr. Sanjay Sood has a rich experience of more than 24 years spanning various geographies. With a global outlook, he is one amongst telemedicine pioneers in Southeast Asia. Sir has been a telemedicine consultant with World Health Organization and an e-health expert with United Nations Office for Outer Space Affairs. Dr. Sood is actively into world-class academics, e-health cutting-edge research, and development and national implementations. In 2002, he led the team that developed India's first indigenous telemedicine technology at CIBioD Mohali. Dr. Sood has authored over 40 world-class publications and articles, including 5 book chapters on telemedicine and e-health. He is a proud recipient of numerous prestigious international fellowships and also the project director of eSanjeevani National Telemedicine Service. I welcome you, Dr. Sanjay Sood.
Thank you. Thank you very much, ma'am. Thanks a lot. And I also welcome co-panelists and the guests at this event. Ma'am, you let me know when do I have to start?
So, sir, if you will allow me to introduce our other keynote speaker, then I will hand over the control to you. Thank you. We are also fortunate to have with us Mr. Sushil Rana, Vice President R&D, Recorders and Medicare Systems Private Limited. Mr. Sushil Rana is a voracious and lifelong learner with a glass is half full mindset. He is a transformational leader with about 20 years of experience in medtech industry in an international environment. He is experienced in telehealth related innovations and affordable medical devices. I welcome you, Mr. Sushil Rana, to this session.
Thank you, madam.
We also have some esteemed panelists with us who I shall be introducing after the keynote talks. So now I would like to request Dr. Sanjay Sood to kindly deliver his keynote address.
Thank you, ma'am. Thank you very much. I'll share the screen for this. I hope I have.
यहाँ से म्यूट कर दोगे तो आपकी आवाज उधर नहीं जाएगी।
यहाँ से म्यूट कर दिया ना?
हाँ तो
ये दोनों ही म्यूट करो जब आपको बात कर।
I hope the screen is my screen is visible on the other end.
Yes, sir, it is visible.
Well, once again, I thank the organizers or the Center of Innovation from Biodesign at PGMER for giving me this opportunity to share or give an insight into eSanjeevani, which is rapidly shaping into a popular telemedicine service in a setting like India, which otherwise has not adopted such information technology applications, at least on the patient end. So Sanjeevani is shaping into, or rather is the National Telemedicine Service, which is being managed by the Ministry of Health and Family Welfare at the central level. And we have two variants of eSanjeevani that those have been rolled out. We have doctor-to-doctor version, which was launched in November last year, and it is called eSanjeevani, and it is being implemented under the world's biggest or largest health insurance scheme called Ayushman Bharat's Health and Wellness Centers, and we are supposed to implement eSanjeevani at 155,000 health and wellness centers across the country, and so far we've done over 4,000 of them. And while we had rolled out, we were rolling out eSanjeevani at health and wellness centers. It is somewhere around March when the pandemic struck, and the Board of Governors, the erstwhile Medical Council of India, released the guidelines, telemedicine practice guidelines for patient-to-doctor teleconsultations. Ministry of Health and Family Welfare wanted us to put together a model of eSanjeevani that could enable patient-to-doctor consultations and could provide during the lockdown, when all the OPDs across the country were closed, to provide health services in the confines of the homes. We put together eSanjeevani OPD, and it is, in other words, called a stay-home OPD. In these two variants, since April 13, we've been running eSanjeevani OPD, and it is now available to the population in around 26 states. And we have over 7,500 doctors who've been onboarded on eSanjeevani OPD, and they've been trained and onboarded for providing teleconsultations using eSanjeevani. And till date, we've done 682,123 consultations on eSanjeevani OPD. And on the other variant, that is doctor-to-doctor variant, under Ayushman Bharat at health and wellness centers, we've covered 15 states. And in those states, there are around 20,000 users, and we've implemented it at over 4,500 centers. And we've done close to around 175,000 consultations. So in all, we are over 850,000 consultations, and it is already one of the larger initiatives in the country that is providing health services from a distance. As far as eSanjeevani Ayushman Bharat or health and wellness centers is concerned, it has been implemented in a hub and a spoke model. We have 190 hubs but we've already done over 4,000 spokes as of now. And most of these spokes have been are primary health centers, and most of the hubs are again the bigger primary health centers plus a few district hospitals and accountable medical colleges as well, where the doctors are available to provide consultations to the paramedics or to the medical officers whenever they're sending the queries to them. And on the other end, eSanjeevani OPD, as I said, is being used by over 25 states of 26 states, and we have 7,600 plus doctors. And there are 236 OPDs, those are functioning on eSanjeevani OPD, and around 30 of them are general OPDs, and remaining 200 plus are specialist OPDs. And we have premier institutions besides the states. We also have AIMS Bathinda, AIMS Bibinagar in Telangana. We also have AIMS Rishikesh, and AIMS Devgarh in Jharkhand is also planning to roll out eSanjeevani or services through eSanjeevani. And if we look at the distribution, the gender distribution, or as far as eSanjeevani's usage is concerned, we do have around close to around 200,000 users who've registered on eSanjeevani. The males, 94 are, I would say, others, and over 233,000 have been females who've been using eSanjeevani. And besides this, we do have a very interesting spread of the people who've been using, or the patients. Around 46% of them are under the age of 30. And another 44% are between 30 and 31 and 60, and 61 plus are around 9%. So we can see that the age group, if we analyze the period that we started on eSanjeevani OPD in April, and in initial period, there were hardly any senior citizens using eSanjeevani OPD, but now that there are few OPDs which are centered around the NCDs or the geriatric care, and even the CGHS, which is central government's health scheme, and the staff of or the employees and their dependents of the central government, they are now using eSanjeevani, and hence the percentage of users in the age group of 60 and beyond is gradually increasing. And this has been the trend for eSanjeevani Ayushman Bharat that we started in November, and it is picking up. And till mid-October, we were doing around 12,000 consultations. We've done 12,000 consultations in first 19 days of October. And today, I think we are doing around 3,000 plus consultations in the month of November. We're doing more than 3,000 every day. As eSanjeevani OPD is concerned, we are registering more than around 9,000 consultations every day. So collectively, we are easily crossing 11,000 mark, which is sizable. And if we look at it from the hospital's OPD point of view, it is comparable to the biggest OPD that the hospital within the country is managing. We understand that there are around 11,000 OPDs, or footfall of 11,000 patients in AIMS Delhi OPD. Those are getting services on daily basis. So eSanjeevani has crossed that level, and we are closing in at around 12,000 patients every day. And considering the trend, it is getting popular day by day. And then another interesting trend which has come out is, if we look at the top 25 districts, eSanjeevani is being used by populace in around 520 districts of the country. It's more than 75% of the districts in India. And we can see that the leading states are Tamil Nadu, Uttar Pradesh, Uttarakhand, Kerala. These are the leading states, including Gujarat as well. We can see that the smaller districts are using it more aggressively, or eSanjeevani is more popular in smaller districts than the bigger ones. The reason could be that the specialized care or the hospitals, bigger hospitals are in the bigger districts or bigger towns. Hence, it is possible that this is the factor. This could be the reason that populace, besides the, they are getting drawn towards telemedicine or telehealth options. And we do have clinicians or telemedicine practitioners who've done over 15,000 consultations. We have more than, I think, 20 clinicians out of 7,000 who've more than 15,000 consultations each. And there are over 200 doctors who've done more than 10,000 consultations on eSanjeevani, and more than 300 doctors who've gone beyond 2,000 consultations as well. So the trend on both the ends, be it the patient end, clinicians end, it is very encouraging. And I can say that the practice of telemedicine is gaining popularity, and it is getting more and more popular. The beneficiaries, that is the patients. Another very
Yes, participants kindly
another very interesting aspect that we've noticed is that rolled it out in around 25, 26 states.
Sorry, Dr. Sood. Can the organizers mute people? Thank you.
Yeah, Gunjan, if you can help us with, yeah, that is fine. I would want to share this perspective wherein the states, it is the National Health Mission in every state that is taking care of the rollout of eSanjeevani services in the state. So the health administrators or the policymakers in the state at the state level, they've been really using eSanjeevani, or they've been designing processes, very innovative processes to use eSanjeevani. We have, although we designed eSanjeevani for non-COVID applications, sort of an outpatient service, but then we noticed that especially Tamil Nadu and Kerala, they wanted to roll it out for the COVID applications as well. Kerala has put together eSanjeevani at two ends, that is COVID hospitals and COVID first level testing centers. So the patient, when he or she comes to the COVID first level testing centers, and the clinicians or the medical officers, in case they find something that is to be queried from the experts, they get connected through eSanjeevani to the COVID hospitals. Every district has around 4 COVID hospitals and numerous COVID first level test centers. So they get connected to the COVID hospitals and seek opinion of the experts who are more specialized in managing COVID patients. So besides that, in Tamil Nadu, they've come up with HIV/AIDS OPD, that is ART OPD, and wherein it is antiretroviral therapy. They've set up the OPDs specifically for people with AIDS. They can seek the services or opinion or support or counseling, etc., from these OPDs in Tamil Nadu. And besides this, there have been numerous instances wherein eSanjeevani has shown up as a savior when the doctors who've been providing services in general OPD, specifically in Tamil Nadu again, they came across a couple of cases like brain stroke case. The patient showed up in the video consultation to the doctor in one of the OPDs in Tamil Nadu, general OPDs, and the doctor could identify that the patient is suffering from brain stroke. He got them connected. He got this patient connected with the nearest health facility and got him transported to the hospital for emergency care or critical care. And there have been a few such cases where eSanjeevani has also been useful as a medium to provide emergency care or provide the first assistance to such cases where the issues have been life-threatening. And then in Tamil Nadu and Kerala, they put together district early intervention centers, which are responsible for taking care of children's health till they get into adolescence. Not only the current health, but also the future health of children. So they put together, every district has a DEIC OPD, which has 3 or 4 practitioners like speech therapist, physiotherapist, psychiatrist, and another a specialist there. And they in group take care of the patients or the calls that they receive through eSanjeevani to cater to the needs of the patients or the parents who come up for consultation in such early intervention centers from the experts. And besides that, another innovation that the state governments have done, especially in Kerala, Palakkad district jail has been connected with the district hospital there, and they have a terminal with eSanjeevani working there. So the inmates, whenever they need health services, they can get into that room. The operator would use eSanjeevani, get them connected to the doctor on the other end during the operation or the working hours of eSanjeevani clinics. So they get the inmates of the jails. There's some sort of a correctional telemedicine that eSanjeevani is being used for. And that is how they are using eSanjeevani to put together a mechanism where they save not only money, finances, but also the security to take care of these inmates and provide quick services without having to displace or relocate the inmates to the hospitals or health facility. And besides that, states like Himachal Pradesh, they are planning to roll out or provide eSanjeevani's interface in old age homes and all the prisons in the state, so that they can extend health services not only to just the patients in their homes, but also to inmates in old age homes or and jails as well. And as regards the innovations on our end, looking at the trend that eSanjeevani or telemedicine is here to stay for long beyond COVID as well. We can see that there is a need. As of now, eSanjeevani is available in Android application, which we are working on iOS application, and it is also available as a web application wherein the patients, in case they have laptop or desktop or larger tablets, they can use eSanjeevani through Chrome browser. And both these variants or both these modalities of internet, that is the PCs as well as the smartphones, Android-based smartphones, they cover just around 30-35% of the populace. So we are working towards putting together eSanjeevani for people who do not have smartphones, who are not IT literate, and who do not have internet access, so to say. So we are working towards, and who are not literate as well. So the first innovation that we are putting together is that we're trying to put together a multilingual interface so that eSanjeevani is available to those who are not literate enough to use the English version of eSanjeevani, and to enable use of eSanjeevani through feature phones or through landlines. We are working with a couple of teams to put together speech to text capabilities in eSanjeevani, which will help people to just call in at a number through IVRS systems, speak out their patient details, and get connected to the database in eSanjeevani, and then that generates a token for them. And whenever their turn comes, the doctor calls back to them, and at the end of the consultation, an e-prescription is generated, which is again accessible either through the SMS or it can be downloaded through eSanjeevani's portal by a pharmacist by speaking to the by calling at a number through IVRS. So we are working with other companies as well. We are wanting to integrate the doctor-to-doctor version with eSanjeevani to enable states to use the diagnostics or diagnostic equipment for tests, or seamlessly getting the parameters from these diagnostic instruments into eSanjeevani and then forwarding them to the specialist on the other end. And we are also banking heavily on the data that is getting collected. We've done, as I said, 50,000 consultations already, and on an average, we're doing more than 11,000 consultations daily. And we are working towards analyzing the data that we are collecting based on the use both variants. eSanjeevani is being used in these states In few states, it is being used for 13 hours a day, all the days of the week. So 365 days, including the national holidays, right from morning 8 a.m. to 9 p.m. And in few states, it is being used for around 6 to 7 hours. So this is what we are working towards as of now. We are pumping up the IEC activities to increase the awareness about eSanjeevani. We are also putting together a national call center to enable support services for patients and for doctors. And we are also working on rapid operationalization of eSanjeevani in various states, and are preparing eSanjeevani for showcasing it at a global level, because eSanjeevani is also being rolled out for Government of India across Africa in 53 countries under the project called E-Arogya Bharati, wherein it'll be a doctor-to-doctor kind of interface. The doctors in Africa, in case they would have any queries, they'll get connected to the specialists in India, and they'll be using eSanjeevani to share their concerns or their queries to get the support from the Indian experts or specialists in the selected hospitals in the country. So that is it I had to share about eSanjeevani. In case queries, I'll be very happy to address them. Thank you so much, sir.
Thank you, Dr. Sanjay Sood, for shedding light on the innovative processes and practices of eSanjeevani in the area of telemedicine. It was always a pleasure to hear from you, and I thank you for sparing time. Now I would like to request our second keynote speaker, Mr. Sushil Rana, to please address the audience. Sir, you will need to unmute yourself, please.
Sorry. Honorable dignitaries on the dais, CIBioD leadership, very good afternoon to everyone, and thank you for having me here. Today, the topic of the discussion is why and how telemedicine will outlast the pandemic. I'm also here to present a use case study on telehealth solution that has been deployed during this pandemic. As we all know, COVID-19 pandemic has emerged as a public health emergency and has become an international concern. And during this pandemic, healthcare delivery to the population has been a great challenge. People suffering from chronic ailments faced very high difficulty to reach out to the clinicians. Thanks to telehealth, telemedicine during this time, that has played an important role for delivering the healthcare during this lockdown. This has also helped in minimization of the infection risk to the non-COVID patients. Telehealth and telemedicine both helped in effective use of physicians' times and optimize the workload during this pandemic. I'll present a use case. Are you able to see my screen?
Yes, sir.
Yes, sir, it is visible.
Yes. So, CIBioD, ICMR Center for Biodesign and Innovation, Shri Venkateshwara Medicare, and RMS jointly collaborated for an telehealth system deployment during this pandemic in the month of April at 2 locations of PGIMR satellite centers. As we have all seen, the telehealth has emerged as a lifeline in the midst of this coronavirus outbreak. Mobility restrictions had made the telehealth systems the safest interactive way for the patients and the clinicians. Telehealth is also bridging the gap between patients, physicians, and the health systems in shedding the patient load at different facilities. It has also helped in minimizing the risk to the healthcare workers. If we see on the telehealth system facilitation, the ICMR Center for Innovation and Barrier Design at PGIMR Chandigarh, in collaboration with the Department of Telemedicine PGIMR Chandigarh, has put telemedicine services at two of its satellite centers in Una, Himachal Pradesh, and Civil Hospital, Sangrur, Punjab. These telemedicine services were facilitated for the existing chronic patients of the PGIMR who need urgent specialist consultation and were not able to move to Chandigarh due to lockdown conditions. These are the few of the media reports that got during this. And these are the usability of the telehealth system at these locations, where it was deployed at different patients and the results were obtained. Departments in which these telehealth services has been started in PGIMR Chandigarh are cardiology, gynae, neurology, ENT, medicine, and pediatrics. Hundreds of patients got the benefit of this telehealth system during this COVID pandemic, and they are continued to have this. Well, as Dr. Sanjay Sood has described in the previous presentation about the eSanjeevani rollout at all the states, I'd like to congratulate him that eSanjeevani has really become a lifeline to many of the patients who are not able to reach out to the clinicians, and this has been a massive success as a telemedicine solution within India, and I think in the coming down world will be using this. I would like to take this privilege to take a deep down to the product and the solution that we have deployed at 2 satellite centers. This is the overview where we have deployed the telehealth system, including the diagnostic devices integrated into the solution, which got the satellite centers at these 2 locations connected to the PGIMR Chandigarh. Apart from this solution is also capable of being deployed at wellness centers, primary health centers, and in ambulances. The differentiation of this solution is this have all the devices integrated into the system, and the system is generating the unique EHR and the EMR for the patients being prescribed. These are the devices which has been utilized in this solution. We had vital sign monitoring, which were capable of taking 12 lead ECG, oxygen saturation, non-invasive blood pressure, temperature, and pulse rate. These are meant for mainly cardiology applications. Then we have POCT devices for glucose and hemoglobin monitoring. Along with that, we had biochemistry analyzer for all of the biochemistry examination, including liver, cardiac, kidney, electrolyte, and lipid profiles. All of these devices with an integrated to the telehealth system has been deployed. Along with this, spirometry, digital stethoscope, urine analyzer, and rapid diagnostic kits were also provided at these 2 centers. This is an overview of the system, how it transmits the data and receives the prescriptions back. The test which I had already described has been collected by all these devices and been sent through inbuilt Wi-Fi GPRS capabilities to the PGIMR Chandigarh, where the doctor using the video conferencing facility and having these results online has prescribed the patients. These are a few screenshots of the Android app which were used by the physicians at the satellite centers to transmit and capture the data of the patients. This is the reporting screen on the cloud software, how the expert at PGIMR Chandigarh would view the data received from the satellite centers. You see the 12-lead ECG along with the patient demographic details. Is able to see all of the blood reports that are being sent from the satellite centers. Symptoms, allergy, medication being prescribed. After viewing all these reports, expert can mention the ICD codes along with his prescriptions and observation in the given text message. So whenever the report is updated, it goes back to the satellite center, to the physician, and this can be downloaded, printed, can be given to the patient. The format of the patient report is as given below, where we can have all the patient demography details, all the blood test reports, and the specialist prescription. The byproduct of this interaction is the analytics that we got, that by using this system, physicians and the expert specialists at PGI stocks, we got these analytics that at what site, how many tests has been performed, at how many patients we got of what with particular disease. So on a single click, the data analytics can be obtained. This got very helpful in classification of the various patients and segregating them. If you see the overall use of the telehealth system and its benefits that we got, and it is continuing to have, is when we get rapid access to the information, we get faster response. Remote access with the data increase the enhanced decision support. And if we get to the patients early, we get lesser damage, along with shattering the various barriers and addressing the various strategic healthcare needs. So this is a small use case presentation that we got in collaboration of the three entities, and patients belonging to these territories got the benefit of it. I will like to conclude with this, and thank you everyone for listening to me. And if anybody has any question, I will be very happy to answer. Thank you everyone.
Thank you, Sushil Rana ji, for sharing an overview of the innovative systems that have been developed by your team, including the clinical devices and the cloud software and associated apps. You have also beautifully highlighted the benefits of the telehealth system. Thank you very much. Now, with the permission of the presiding guest, Dr. Bhamra, I would like to initiate the panel discussion and introduce our esteemed panelists.
Thank you very much. So these are very interesting talks, isn't it? Sitting here in the UK, in Manchester, by the way, good morning, and I'm delighted that I'm in distinguished company, none other than Dr. K.K. Talwar, and thank you very much, CIBioD, for inviting me. Let's listen to what's happening around. I mean, I think as both the speakers have very eloquently said, telemedicine is here to stay. It took, unfortunately, something like COVID to shine the light on what we were doing, which was really, we were not, something positive has come out of COVID, isn't it? Despite the tragedies, which is, I do a lot of my clinics now entirely through video or teleconsultations. So let us see, Dr. Talwar, firstly, I think you are in the audience. I wonder whether you would like to say something. Dr. Talwar? Yes. Would you unmute yourself, please?
Sir, I believe Dr. Talwar will be joining us after some time.
I'm there. I have joined already. Hello.
Okay, I am
Hello,
sorry
Dr.
about
Talwar.
that, Dr. Talwar. Please allow
Yes, sir,
me
you are
to
audible.
formally introduce you.
Formal introduction would be good. Although Dr. Talwar, by the way, does not need any introduction.
No, thank you so much.
But go for it. Go for it.
I must first thank Dr. Garg for this opportunity and for this very important session. And Dr. Pamra, as you rightly said, that probably this pandemic has tried to little, make that how this kind of technology is useful in medicine. I must say that in 2005, when I was in PGI, that is the time when we thought that we should have outreach activities for the PGI, and we initiated our telemedicine services or effectively telehealth services. So I think that was just that we got connected to some of the villages in Punjab with the help of ISRO facility. So anyway, now we know that how, like these days, most of the consultations in medicine, I know in various fields, through even patients are comfortable because they don't have to visit the hospital because they are worried that because of the COVID issue, they may not get into difficulty because of that. So I think, look, I must also mention that most of these platforms, communication have been very good also. Most of the meeting you find that communication is very good. Like, so I think that has been a great thing. And I think in future also, I'm sure tele-education, telehealth will now continue even after the pandemic is over. It will be like a hybrid, both for education and for the health sort of follow up patient, just doing on that way. So I congratulate Dr. Garg to think of this sort of subject and then have distinguished people who have shared their experiences. And I think I look forward to learn from others and listen from others, and then we can see. Thank you, Dr. Bamra. I think.
Thank you very much, Dr. Talwar. And of course, Dr. Vrinder Garg is himself a great innovator. I'm so grateful to him for bringing this together. I think one of the things that I would be interested to hear from our panelists is the safety and effectiveness of telemedicine. So this is, I mean, I'm absolutely amazed that PGI has been doing. I'm not surprised, but amazed, doing it for such a long time. Of course, in the National Health Service in the UK, it is only relatively recently, really only since the pandemic, that many of us, if not all of us, are doing telemedicine. So I would be interested to hear from people what they think about the safety and effectiveness of, particularly in some branches such as surgery, it's really difficult to implement telemedicine. I wonder who would like to go first amongst the speakers. Do you want to put up your hand, or do the organizers want to help me?
Dr. Bamra, thank you for setting the context for the panel discussion. Please allow me to introduce our esteemed panelists before we begin with the discussion. We are privileged to have with us Mr. Pavan Chaudhary, Chairman and Director General, Medical Technology Association of India and Managing Director of Vigon India. Mr. Pavan Chaudhary is a professional of repute, having 28 years of experience in the field of medical technology. He is an eminent member and expert in various committees pan-India. Since 1998, Mr. Pavan Chaudhary is the CEO and Managing Director of Vigon India Private Limited, a leading French multinational in healthcare. He chairs the Medical Technology Association of India, is a trustee with the Lal Bahadur National Memorial Trust, an independent director with TransAsia Biomedicals Limited, and sits on the advisory board of Executive Access Private Limited. I welcome you, sir. We also have on our panel Mr. Vaibhav Tiwari, Chief Operating Officer, Portia Medical, Karnataka, India. Mr. Vaibhav has over 18 years of diversified experience in building new businesses across industries, such as business process outsourcing, technology, and supply chain management. He was the co-founder and CEO India at iSeva, a leading BPO company, and grew it to 2,200 employees in 5 years prior to its acquisition by E4E in 2005. iSeva also consistently ranked amongst the best BPO companies to work for in India. We welcome you, Mr. Weber. Our next panelist is Mr. Gautam Khanna, CEO, Hinduja Hospital, Mumbai, and President, Association of Hospitals, Mumbai, and Co-Chairman, FICCI Health Service. Mr. Gautam Khanna is the CEO of PD Hinduja Hospital and MRC Mumbai, and is also the head of Hinduja College of Nursing. He is on the board of 2 private hospitals and a managing committee member of a degree college in Mumbai. Sir has more than 30 years of industry experience internationally. Prior to this role, he was the executive director and country business leader of the 3M healthcare businesses for South Asia region. Mr. Khanna is an active member of various leading industry associations and has held several key positions. Welcome, Mr. Gautam Khanna. Our next panelist is Mr. Ott Sandberg-Koch, CEO and co-founder, Infiniwell.ai. Mr. Ott is the co-founder and CEO of Infiniwell.ai, a software medtech company headquartered in Trondheim, Norway. Infiniwell specializes in AI analysis of patient data, such as vital sign parameters and waveforms, adding real-time diagnostics to traditional patient monitoring equipment. Mr. Ott has spent more than 25 years in R&D management, leading large-scale multinational high-tech development projects, as well as organizational transformation efforts. He combines his experience in real-time systems design, telecommunications, and artificial intelligence to create Sentio, the world's first intelligent telemedicine system. Welcome, sir. Our next panelist is Mr. Hitrapreet Kang, Global Head of Strategy and Sales at Clarity Medical, Chandigarh. He has a vast experience in the field of technology and cloud computing. Mr. Kang has a BE degree from Thapar Institute in Patiala and an MBA from University of Florida. Prior to joining Clarity Medical, he worked for many multinational companies. Mr. Kang is an advocate of telemedicine solutions that help deliver quality medical care to communities across the globe, including remote regions. With technology and AI playing a dominant role in the field of medicine, Mr. Kang has dedicated himself to shaping telemedicine. I would now hand over the control to our moderator, Mr. Pavan Chaudhary. Sir, we have a humble request of concluding the deliberations of the panel by 3:25 p.m., please.
And let me also correct, it is Hitpreet Kang. My apology for...
My apologies, sir. My apologies. Mr.
Thank you. Thank you.
Over to you, Mr. Chaudhary.
Pavan, you are muted.
So the controls are in my hand, but the clock is in your hand. Great. So coming quickly to the meat of the discussion and then going to the point which Dr. J.S. Bamra has suggested we also cover. The topic for today's discussion is why and how telemedicine will outlast the pandemic. So, to discuss whether this genie which has come out of the bottle will now never go back in, let me try to look at this from the various lenses of different stakeholders. So patients are one stakeholder in this game. The second stakeholders are the doctors or the providers. The third are the payers. And the fourth is the government. Since healthcare so far has been residing mostly in the shrine called hospital, let me start with Gautam Khanna and ask him, what does telemedicine bring for doctors and providers? Gautam.
Thank you, Pavan.
and wonderful to listen to all the speakers. And I really admired the knowledge which was shared today. So Dr. Sood, thank you. And Dr. Rana, thank you so much. So talking about video consult, when like I would like to say that I know that Dr. Sood has talked about a lot of work being done since earlier years, but I think the rollout and the success of video consult is more out of COVID necessity than any strategic roadmap which the private hospitals were doing, or because there were no specific guidelines, it was not allowed, and so on and on. So having said that, before I talk about what the hospitals do, I want to just share a bit of statistics. There was a study done by Ernst & Young in September this year, and they have estimated that telemedicine market will reach 5.5 billion in 5 years. And 4 things will contribute, which is teleconsult, means the video consult, telepathology, teleradiology, and e-pharmacy will contribute 95% of this growth. And the other thing is, from adoption of this teleconsult, if you see the statistics, and Dr. Sood's statistics actually hit on the mark, and I had my point and I was thinking that, absolutely correct. The southern states have adopted it wonderfully at 62%, followed by West at 52%, followed by North at 50%, and East only at 30%. So South has been a rapid adopter of video consult, and also 52% of the metro doctors have adopted it versus the non-metro, which is 44%. The only concerning point I wanted to say that although many consults have happened, only 11% of the sessions have happened through a practice management software. Rest have all been phone calls. So I am going to spend a little more time on that. And I just want to say that when we talk about video consult from a hospital perspective, we have to understand, and Mr. Rana talked about the benefits to the patients and so on. But we have to talk about the patient confidentiality. We have to talk about the medical ethics. We have to talk about the satisfaction to the patient and clear diagnosis and assessment by the clinician. So now what we have done is that we went through a software where now it is something that you can book online, call center, a patient can book, and patient can actually upload their reports, because you have to understand that many patients are outside and they want to show their previous reports to the doctor. How do they show it? So they can upload this. So you need a system to do that. Phone cannot do. So they can upload the system reports. The doctors also have a preferred list of medications. So we don't want them to waste their time. So we can upload them and then they just do ABC and just give a e-prescription. The other aspect on this is that sometimes the senior doctors are very busy. And all of us know in India, the doctors have no time. So we also have an opportunity for a 3-way consultation, that a senior doctor, a junior doctor, and the patient. So senior doctor can advise and then junior doctor can write the prescription like in a physical OPD. So that I think is a good thing. The other thing I wanted to say is that in case the doctor feels that a physical consultation is required because somebody mentioned about surgery, then the same appointment is transferred to physical, of course, no extra charge, and we done that. I want to share one thing with you, that in this pandemic, we did not realize how successful it will be. And of course, not to the scale of eSanjeevani, but we have done in the last few months, 27,000 virtual consults from 260 cities in the country, including 10 abroad. So 250 in the country, 10 cities abroad. So what that means is that suddenly it has given access to hospitals like us to the patients across the country. It has given opportunity for less crowding in our physical infrastructure, because 27,000 patients have not come to the hospital. And our doctors who had some physical clinics, 3 times a week, 2 times a week, now can do 6 days a week. And we've also had cases of doctors who were actually on quarantine, but they were doing consult from home. So that's a great advantage. And one innovation I just want to mention what we did, and I was really happy to see the innovations by eSanjeevani, is that when the COVID hit, we found that the patients who are in isolation at home, they also get a lot of anxiety and fear because actually there's no doctor at home. They're just told that you be at home for 14 days. And they want to be reassured. So we utilized these services and launched a COVID home care package, which is a 14-day package where you have 4 video consult with a doctor, nurse monitors the vitals every 8 hours. There is a physiotherapist who on the remote will tell you what to do, a dietitian, and a consultation with a psychiatrist, because the mental health during COVID isolation is also a key point. And I have to say this, that we've done more than 600 in the country till now, and we've had requests from Darbhanga, Bangalore, and of course Mumbai. So all these things I think are important. And one thing I just want to caution for this is that the statistics which were shown that more than 61% people are only 9% of the patients who are utilizing e-consult. So we recognize that. So what we have done is, when an appointment is done for a senior citizen, our team member actually calls them and guides them step-by-step process on how to manage this, because we all know that technology is difficult for senior citizens. So we've done that. And I just want to end, Pavan, if you will allow me, for one more thing, that I think there are examples of this across the country, across the world. People have used it in different, in the US, there have been hospitals who have been using this for a long time. Retail stores have been using it. In India, Tanishq has been selling jewelry. Can you imagine Indians buying jewelry through remote? But they've been selling jewelry through remote. So I think the benefit of convenience, less crowding, time saving will keep this initiative going in the country. And I don't know about all of you, but my personal desire is that whatever we are doing, we should do 3 times of that, or maybe 5 times of that. So I will hand it over to you, Pavan, with that. Thank you so much. Pavan, you're on mute.
Excellent start, Gautam. You have shared with us not only all the advantages it brings for the doctors and the hospitals, but also what it brings for the patients. And on that point, I am just reminded of a research we did recently. We found that one more reason why patients want to go on telemedicine is because telemedicine allows them little better treatment by even the arrogant doctor, or let me say a doctor who's a little brusque. And we also found a similar study among the lowest of the income categories going for e-commerce buying. E-buying they have taken to in larger proportions because they were not getting the dignity in the shopping centers. The shopkeepers or the stall keepers, as well as the neighboring fellow shopper, were not treating them well enough. So they have similarly gone on to this bandwagon in a big way. But without taking this talk on that track yet, I come to Vaibhav to tell us what would he like to add to the statistics, and more or less the statistics, but why doctors and hospitals have taken to telemedicine in a big way. And then I will come to Odd and Hitpreet, to ask them as to why patients have taken to telemedicine in a big way, because they are operating very much at the patient end. Vaibhav.
Yeah, thanks, Pavan, and very nice to hear Gautam's views. Actually, we do a lot of work with hospitals. So just to give a quick background, if not everybody may not be aware, Portia Medical is India's largest outside the hospital healthcare services company. That basically means we work with patients in their homes and provide all the healthcare services which can be performed at home. And we have been working in this space for quite some time and support almost supported over 1 million patients so far. And I'll give a quick background about what we have done from a telemedicine perspective. That will give you a point on how doctors are adopting to that, and of course hospitals are adopting to that. So when this whole COVID crisis hit, we created the whole home isolation program along with multiple governments, which started with Delhi government and then of course worked with multiple states. Right now also running it for Punjab, for example. So anybody who tests positive for COVID and is basically advised home isolation is managed completely by us with doctor consult and of course on the ground requirement wherever possible in terms of escalations. And we have supported over 2 lakh patients in home isolation in last 6 months, working with various governments. And I'm bringing it up because this whole program got created and we have done it across 7 different states. And as Gautam was saying, it all got created across the board without anybody meeting anyone. So we working with government, we putting the doctors plan together, the healthcare worker, teleconsultation platform, the patient engagement platform, everything happened. The whole coordination, everything happened remotely. And the whole piece came together very, very well. So in the peak, when the COVID crisis was at the peak in August, September kind of time frame, we were doing almost 4,000 teleconsults a day with doctors sitting across different states. And of course, talking to the patient because we had to keep these patients in good health and make sure that they are taken care of during their home isolation period before they test negative. So we ourselves have seen tremendous surge in patients, of course, doctors looking at how they can leverage this channel. So before that, of course, the way doctors have always worked mostly in the country, it's always about people coming to the clinics or to their OPDs and taking consult. But so for the first time, doctors realized that it's possible to do that, and it's possible to do that quite effectively. And for us, the COVID support, of course, has been one of the big things. And we continue to do that. Even now, we probably do anywhere between 2,000 to 3,000 consults a day and have probably done over maybe 3 lakh consults or so far in last 6 months for patients, which include both doctor consults as well as other health-related consults. And what we are seeing now when we are working with doctors and hospitals from a patient treatment perspective, also doctors are a lot more open to trying it out because now doctor can see more patients than what probably they saw in their OPDs, can consult the patient, and then of course with us they also complete the continuum. So doctor will do the consulting for the patient, and of course we take it over from there, whatever is required from a home care perspective, work with the patient and make sure that their healthcare requirements as per the doctor prescription or as per the discharge summary is completed. Other thing which we are seeing from many hospitals as an early stage, but we believe a thought which will become a lot more prevalent, is that hospitals are looking at how they can engage patients a lot more, given that, okay, you start with a teleconsult, patient has to come back for another teleconsult, they have to do any of the diagnostics, any of the medicine delivery, and so on and so forth. So the whole care continuum can be completed along with doctor in the center. So hospital puts doctor is doing the OPD consult using teleconsulting, and all the pieces around that in terms of managing the patient life cycle is driven by partners like us and of course others as well. So what is called discharge management. So a hospital discharges the patient and the complete discharge management can happen centered around the doctor's prescription and the doctor consult. So we are seeing tremendous interest in that area. Given that patients are wary of coming to the hospitals now, we also believe that both from doctors and hospitals perspective, that's another thing which should gain momentum going forward. So I think happy days for teleconsulting, and I believe, as Gautam was saying, maybe 4 to 5 times growth, if not more, is very much possible. You're on mute. You're on mute, Pavan.
Very good points, Vaibhav. So if I was to wrap up this part of the discussion, I will say these 7-8 points. First is the doctor doesn't have so many missed appointments and cancellations. He can have increased revenue and manage his patient loads better. He can provide take teleeducation, teleconference, and teleproctoring to a new level. The triaging of the patients can be done because hospitalization only needs to be done for the critical patient. So in a way, telemedicine will heal the doctor and patient alike, because doctor was also having a huge cognitive load, huge waiting room pressure, and archives were not available. So with telemedicine, as Dr. Sanjay Sood was mentioning, if we have these health records, allergies, etc., at the click of a button, which Sushil Rana also spoke of, then the inaccuracy, 5 million errors, medical errors happen in India every year. That inaccuracy can be reduced, and even waste can be reduced, because if the patient doesn't come to the hospital, then the waste is reduced. So in terms of serving the doctor community, telemedicine really scores very high marks. Let us go to the patient. How does the patient benefit through telemedicine? Odd.
Yes, thank you. It's really amazing to sit here in Norway and listen to you describe my country, because it's the same problem, same opportunities, same struggles we're having. So this is truly an international pattern. We were seeing that patients want to stay at home. Nobody wants to be in a hospital, whether it's for an examination or a visit or monitoring. So the fact that we can avoid moving patients, it's a huge gain for a couple of reasons. First of all, it's much less strenuous on the patient himself, but also patients feel more comfortable within their own home. So that it's almost like an empowerment thing to have the doctor visit them, even if it's virtual. It's a more relaxed scenario. I have an old father. He lives in a relatively large city here. If he needs to go to the hospital, he needs to go into an unfamiliar environment. It's a bit of a project to get him, into the car and drive the 10 minutes where the hospital is. That hospital may as well be 5 hours away for him. So we're seeing that there's a lot of benefit for patients, both in rural areas as well as the metro areas, not to have to do this physical movement. And that's probably the biggest impact that we're seeing. And we're so happy now that technology is catching up to our desires to move care from the hospital into the home. I think that is a transition that started, and it just won't end. So we have to be very careful that we do it the right way. We have to focus on security and making the patient feel secure in that area as well. So it's really an amazing industry to be working with right now. It really is.
Great points, Ard, and you added complexion to the point of travel, the commuting money, the money which goes in commuting, the time which goes in commuting, the work which you miss when you have to commute, the effort which you have to put when you are frail and tender yourself, and also the psychological stress you have to go through when you go to an unfamiliar surrounding where everybody may not be very compassionate towards you. Great points. What would you like to add to that, Hitpreet, for the patient?
Yeah, thank you. I really appreciate it. So first of all, I really want to thank the Center for Innovation in Biodesign. I really appreciate you guys organizing this session. I've attended a couple of sessions since yesterday. Very informative, very, very accomplished panels. And I'm certainly privileged here to be presenting and talking to you guys today with the company that I'm sharing right now. So really appreciate it. So I want to bring a little bit of international perspective to the discussion. So I spent a lot of time in the United States, and when I started working with Clarity Medical and executives here, it was very clear that there was some work to be done in terms of understanding, telemedicine and telehealth and tele-ICU as well, right? So I'll come to the patient side here in a second. So we actually talked to a number of physicians and a number of patients as well. So we did our own little survey to really understand and make sure that we are actually delivering the right solutions to the community out there, right? So I'll tell you a story about a physician that we spoke to in Vancouver, Canada. His name is Dr. Satnam Gandam. You guys can look up his name if you're interested. So he actually started telemedicine in 2004, right? So the topic here is why and how telemedicine will outlast the pandemic, Okay, so we are now, let's go back 16 years ago. There were some early adopters in the physician community who wanted to do this, right? Internet came in and it was providing some tools, although those tools have improved significantly over the years, but there were some tools and some of the early adopters wanted to get in. Guess what happened? That doctor's license was challenged by the board of British Columbia. Why? Because he was now providing services to patients who were not in his province. So he lives in the province of British Columbia, and there were patients in other provinces of Canada. So licensing works kind of differently in the Western countries, right? You're licensed in a certain state or a certain province, and that's where you can practice medicine or law or whatever your profession might be. And he was actually disciplined by the board, basically given a warning that, hey, you can't do this. So here we are 16 years later, we are talking about telemedicine, and what has happened is with the pandemic, certainly it gave the impetus and it gave the thrust and the push for it to come into the mainstream. We heard a couple of case studies and they were very exciting. And now it's obviously becoming more and more mainstream, right? So we also at Clarity Medical, if you guys want to go visit our website, clarity-medical.com, you will see that we have some case studies that we have put up there that talk about our solution, because we are very aggressively pursuing the telemedicine market, because we have smart devices that we manufacture, which are IoT devices. They talk to the applications on the software side. The data is sitting in the cloud, and the data can be presented to a physician on demand, wherever the physician might be. Yeah. So now coming back to the question that was posed, so understanding the benefits and the risk is very important. So we talk about benefits, right? So there are hospitals, there are physicians, there are patients, but we also have to focus on the risks so that we can mitigate the risk, right? I mean, medical industry is obviously something that you cannot be wrong too many times. I mean, you cannot be wrong, period, right? And physicians are very, very careful in that. So the adoption by the physician community is only going to happen if we make them comfortable that we have taken care of the risks, and hey, here we are mitigating the risk for you. So when it comes to the patient, obviously, Odd pointed out, the patient is going to appreciate the convenience that telemedicine provides.
I think we've lost Hitpreet. Okay, so I hope you can all hear me. I think he has made a very
to that. With that, though, the documentation. Can you hear me?
Yes, Hitpreet.
Hello, can you hear me? I
patient,
apologize.
how does it
very
benefit
important point that
yeah.
Correct.
Yeah.
So I think the patient and the doctor, the trust has to be established between the patient and the physician, which is always the case, right? But now they're remote. Okay. Now the data that the doctor is looking at, is that trustworthy data? That's important. Where is this data coming from? What type of device is this data coming from, right? So we at Clarity Medical, we have an ICU grade monitor that has the capability to transmit real-time data. It is ICU grade. It is not a gizmo. So we've seen a lot of gizmos out there, right? But that trust has to be established. And then the patient feels that, okay, the doctor is actually viewing data that is reliable and trustworthy, right? So that trust has to be established. That's number one. Number two is that data, where is this data sitting, right? So we have to make sure that the data is in a secure place and it cannot be breached. That's extremely important. So in the West, in the United States, and in Europe with GDPR and HIPAA regulations, it's a very well-defined process that you have to go through to make sure that you're compliant, right? In India, it's coming. It's going to come. Patients are going to be very mindful of, hey, who's looking at my data, because it's a sensitive subject. And so we as technologists and we as providers of the solutions to the medical community, we have to make sure that we give solutions that are secure, and accessibility is easy, but accessibility is given to people who really need it, and that there cannot be breach of data, right? So I think if we address these concerns, the patients are going to be very comfortable adopting telemedicine.
Yeah, great. So 2 points which you made, which resonated very strongly with the Indian landscape also. Here also, Niti Aayog, which is the government planning commission here, they moved quickly this time and released, along with Ministry of Health and Family Welfare, the telemedicine guidelines, which allowed the RMP, the registered medical practitioner, to dispense remote services which were not allowed earlier by MCI code. So that was a good move forward. And the other points which you made regarding patients and the previous speaker also. So other than saving time, medical costs, as well as disruption of schedule, the patient also doesn't go through the infection risk which the hospital visit can bring him. Even greenhouse emissions are reduced because transportation is reduced. Stigmatized indications like sexology, psychosomatic or psychological issues, alcoholism, etc., which often label a person in a taboo kind of a way, they also can be discussed in the privacy of the home. And in some places, accuracy also goes up, because there is, as you know, white coat hypertension, which happens just because the patient is in the hospital and he's getting his blood pressure tested by doctors wearing aprons, etc. And that whole atmosphere makes him apprehensive, and the blood pressure goes up. But at home, if you are using the right point of care devices, as you said, that also is that is not the case then. Also, you spoke about the data, how it will be saved. So if we go to Dr. Bamra's point, he said whether telemedicine will be safe and effective or not. So safe for the patient as a patient, and safe for the patient as a discloser of information. So you said that data has to be stored well. Yes, it has to be aggregated. Maybe it has to be anonymized. Maybe it has to be held only for short periods. But we are focusing right now, as you very well did, on the benefits of telemedicine, why this omelette will not turn back into eggs. So coming now to the payer piece and bringing in Gautam again. Gautam, in 1 or 2 minutes, please tell us how telemedicine benefits the payer. And then I will go to Vaibhav and ask him as to how telemedicine benefits the government. And then I will try to wrap up this discussion and go to the other points which Dr. Bamra pointed towards and close in time. Gautam.
So Pavan, only in 1 minute, I think from a payer perspective, now, in COVID, all hospitals have put a lot of precautions and measures for COVID security and so on. And there are extra charges being put in a hospital. So first is obvious is that if you don't visit a hospital, you don't pay those extra charges. So that is one. Second thing is many hospitals have now had a layered consultation, that if you are doing as a senior guy, then you pay X rupees. If you're doing with a junior guy or a middle guy, you pay X by minus Y or whatever. So there's a different amount. So the patients can actually choose, depending on what they think, they can choose the type of consultant and decide not to go. So that I think is, and of course, everything is online. You pay online through your credit card, debit card, net banking, whatever. So everything is payer benefits. And now there are special offers to patients, because hospitals also want to encourage video consult. So they're saying, if you stay at home, I'll give you X% off on consult. So, payer benefits ultimately. So I'm just going to leave it at that.
Excellent point. By the way, Gautam, I congratulate you on starting this in your hospital, because in my hospital, this concession has not yet come. So the doctors are charging the same amount. And I feel that psychologically, you feel that your meeting lasted only 3 or 4 or 5 minutes. But usually face-to-face, it was longer. But anyway.
Pavan, can I take 10 seconds to make a point?
Yeah, go ahead, Hitpreet.
For Mr. Khanna makes a very good point, and I think for you as well, Pavan, and for others who are running hospitals or who are in that business, what we are seeing is that we are breaking the walls of the hospital, essentially, right? So you release a patient, and somebody talked about engagement, right? So you still want to engage with the patient who may have had some serious surgery, right? And at some point, you're going to release them. And now the walls are gone, right? The patient's at home, and you are still able to monitor the patient remotely, which I think is a great benefit for all the hospitals. Just want to make that point.
Great point. I have been asked to wind up, so let me just take one minute each to give 1 minute each to Odd as well as to Vaibhav. Vaibhav, you please tell us how the government benefits, and then I will come to Odd.
Yeah, so I think, Pavan, from government perspective, it's very clear, especially having good quality doctors in tier 3, tier 4 cities, rural areas and all that has been at a luxury for the country. And with telemedicine being in the center of healthcare now, even also as a part of NDHM actually, I believe that this helps government in a big way to bridge the gap between haves and have-nots from a healthcare perspective. So a person sitting in a rural area, in a small village also probably, and with internet going everywhere, it's very easy for them also to consult a top doctor, or at least a good doctor in a tier 2, tier 1 city. That's something which was not accessible earlier. Even modernizing PHCs with teleconsulting is something which can change the way whole healthcare is being accessed and delivered in the rural areas and the semi-rural areas. So from government perspective, is something which makes it so much more scalable all of a sudden. It's not so much people dependent. So healthcare in many ways is one of the very linear services so far. Telemedicine makes it a very non-linear service. And then access becomes a lot more omnipresent than what it is today. I think for government, it's a real win-win.
Great. So basically for payers, it means less cost, because accurate and effective prescribing is a shadow of digital prescribing, because digital prescribing is arm's length prescribing, and the tests also which you advise after careful thought, as well as looking at all the archives. And from the government side, the other point which has come is the shortage of nurses and doctors. Say we have a huge shortage, let me not get into the numbers. Large gatherings of people happen in places like Mahakumbh, and prevention and public health piece also can be pushed through telemedicine. Your comments, Odd, and after that I'll wind up in 1 minute or 2.
Sure, yeah, thank you. We're talking about healthcare, and it's increasingly digital healthcare now. And so it becomes more convenient. I think the main point that's going to make telemedicine stick is the economics of it. The economics are now aligning with the desire to provide more care, the desire to stay at home for the patient. So now the technology is catching up, policies are catching up, the economics are going to be supporting all that. And I think that's going to be the biggest driver here. It's simply going to be cheaper and more scalable to do it this way. You're not going to put that genie back into the bottle.
Great point, Odd. So I am reminded, after listening to all of you, how it benefits patients, doctors, hospitals, payers, government. I am reminded of only one similar instance, which was when Henry Ford brought his assembly line manufacturing. His assembly line manufacturing made the employee win, because higher wages and lower working hours. Made the customer win because of lower cost. Made the employer win because of higher profits. So everybody won. And which is why that such instances or that instance hit communist ideology much harder than any capitalist doctrine. So it just pushed it out of the table. So this is what I feel is telemedicine, very similar to it is an omelette which will not turn back into eggs, because the physician, clinician, doctor, payer, everybody benefits. So that is why we feel that it will last far beyond the pandemic. The pandemic may have triggered it, but it will, its going away will not stop it. It has got very solid wind beneath its wings. And thank you very much. Excellent panelists. And I also noticed that the audience and our chairman is also very happy with us. Dr. Bhamra, we will discuss the safety and the efficacy part some other time in greater detail, but I hope we have been able to peripherally touch it. Thank you very much, everybody.
Thank you.
Thank you all.
Let's do this. Let's do this.
Thank you.
Bye-bye.
I thank all our esteemed panelists, Mr. Gautam Khanna, Mr. Vaibhav Tiwari, Mr. Aud, Mr. Hitpreet, and our moderator, Mr. Pavan Chaudhary, for their invaluable inputs. It is my proud privilege now to invite Dr. K.K. Talwar, Padma Bhushan, to address the audience and say a few words, please.
Thank you so much. I think it has been very sort of interesting session, and I just like to share with my all colleagues that I think in major institution, tele-education and telehealth has been going on since early 2000, maybe late 90s. We even like both in AIMS and PGI has Indo-African interactions for tele-education and telehealth facilities. But of course, this pandemic has really sort of established that how this platform can be useful for telehealth services and tele-education also. I think a lot has been said. I will only just like to some kind of a little concerns also we must appreciate. Coming on to tele-education, I think is very important. But when you talk about skills, teaching skills, I think they are very important. That physical examination and physical training program by the bedside, I think still we will have to, we can't, these technology cannot replace in medicine. So I think the approach to the patient, sort of examination of the patient and coming to the conclusion, because sometimes examination is a very vital aspect of a telemedicine facility or giving somebody a medical advice or care. Similarly, in the telehealth issue, when we talk about, I think the benefit is enormous, but little we must realize the limitation of it, that in some time, particularly when you are seeing a patient for the first time, a physical examination is also very vital. Some of the findings, I mean, you may otherwise miss. You can't just go by the version of others, because I think, I mean, they're in clinical practice, missing something like some really somebody has a large liver, you have forgotten to see the JVP. So the diagnosis changes. So what I'm saying, physical examination, particularly when you have to see the patient for the first time, on follow-up is fine. You know the patient background, you can review his investigation, and you probably can give it to a right kind of advice. So I think that is a small, we have to appreciate, I mean, but then it's going to be hybrid on the pandemic. We are going to use this facility a lot. Of course, the physical examination, physical contact will still continue to be in medicine, and that's important. Two issues which have been sometime bothering us, because as I mentioned in these major institutions where one has been working, both AIMS, New Delhi, and then PGI, Chandigarh. One is of the legal aspects of your consultation. I think that's an issue that suppose you advise somebody and without examination, what are the kind of legal aspects tomorrow? So that is another one area I think we were not very clear, but I think with this kind of this frank, everybody appreciation and more kind of insight into this, That is one. Of course, the second is confidentiality of the record of a patient. So these are the couple of things which have been a little concern to all of us when we have been using these telehealth and teleeducation facilities. And as I said, that I think it is this pandemic has really highlighted the strength of this particular platform. And in post-pandemic, it is going to be hybrid, a combination of both the physical contact, physical examination, as well as even training programs, bedside teachings, plus the I think tele facilities. So I think this pandemic has really sort of made us realize, and no doubt there is a benefit that you can consult somebody even outright, second opinions. This has been the a kind of now recognized possibility in health system. You might like to have somebody has been diagnosed with some kind of a cancer or some kind of a tissue diagnosis. You might like to consult somebody more expert into that. This has been also a practice, and these kind of technology helps you to little have it more quickly and with more satisfaction. So I think thank you so much for this. As a lot has been said, I don't want to repeat, but I think I congratulate the organizer to keep it as a session today. And there have been, I think, distinguished panelists, speakers, highlighting the sort of strength of this tele-education and telemedicine. Thank you so much.
Thank you, Dr. Talwar, for sparing time from your very busy schedule and for highlighting the concerns related to the area of telemedicine. Ladies and gentlemen, CIBioD has constituted an award for social leadership for making healthcare affordable. With the kind permission of the presiding guest, Dr. J.S. Bhamra, I seek permission to confer this award virtually, sir. The CIBioD Social Leadership for Making Healthcare Affordable Award goes to Vanvassi Kalyan Ashram and V4V, an NGO. I would now like to invite my colleague, Dr. Mandeep Singh, to introduce our awardees.
Am I audible?
Yes, sir.
Yep.
Yeah. Good afternoon, everyone. First of all, I'd like to thank the whole CIBioD team for this wonderful online summit on affordable healthcare, which brings so many stars and elite persons in this field of healthcare and biomedical in a single platform. Today, I'm delighted to be a part of CIBioD team and who's going to announce these awards on behalf of CIBioD. These awards for those organizations which are involved in affordable healthcare and through social leadership. And the first award goes to Vanvassi Kalyan Ashram. And I congratulate Dr. Uday on behalf of Vanvassi Kalyan Ashram. This organization is working in different fields such as education, hostels, healthcare activities among women, sports, rural developments, and many more. The main objective of VKA is to eliminate chasm between Hindu community and their Vanvasi brethren with affection and good faith. That was the major contribution. It will certainly help in developing a sense of belongingness among the Vanvasis. For attaining this aim, various projects aimed at removing the differences from both the communities are started. Several volunteers are working full-time for the educational, health, and developmental, either they are social, religious, or spiritual projects started by this ashram. So I once again congratulate Dr. Uday and Vanvasi Ashram team. The second one is CIBioD Social Leadership Award for making healthcare affordable goes to Zero Hunger with Langar. So for those people who are not aware of the word langar, this is a community kind of kitchen or a free meal to everyone without discrimination of race or religion. Zero Hunger with Langar was founded in 2016 by Shri Jagjit Singh Ji. Zero Hunger with Langar is working in 2 African countries, Malawi and Kenya. Such countries have highest malnutrition rate among children and features in their UN's target list. It is working under its parent body, Shri Guru Nanak Nishkam Seva Jatha. It is currently serving over 1.5 lakh meals per month on malnourished children in Malawi and nearly 8 lakh meals in a month in Kenya. Since 2016, they have served more than 3 million meals in Malawi. So I once again congratulate both of these organizations. And thank you very much all the panelists and CIBioD team for giving me this opportunity. Thank you so much.
Thank you, Dr. Mandeep, and congratulations to the awardees. I would now request our presiding guest, Dr. J.S. Bamra, to deliver his presidential remarks and conclude the session.
Well, thank you very much. Thank you. It's a privilege as a board member of CIBioD to display such huge talent that is in and around India, and of course in Norway as well. So it was lovely to see Odd and Virender Garg. I'm so privileged that I was made member of this board. Thanks to you. I think there is so much that we could say about this subject, and I hope that this is an ongoing dialogue. Because as our very able moderator said, you can't make an omelette back into an egg, and Odd said, you can't put genie back into the bottle. What is very important is what Hit said. I think it's very important to understand, as we do in GDPR, safety, confidentiality. Those are very important things. When I was studying Patiala Medical College, I didn't understand these concepts at all. I understand these better now. And also it's very important to understand that telemedicine is great. It's going to reach out to rural areas. Sanjay did a fantastic presentation, I have to say. All of the presentations were amazing, absolutely. But what Sanjay did is very simply put to us how this can reach out to rural India, where medicine, as you're aware, we do not reach out as well as we should. It's going to be cost effective. Well, it's going to be less costly. Let's make it cost effective as well. So let's keep on with the work, folks. Let's build on what we've got. COVID has opened a lot of areas for you. Keep going, keep plugging, and we're going to get there. And we're going to make medicine the best ever globally, but especially in India. Thank you very much, folks. Thank you. Bye-bye. Take care, stay safe.
Thank you.
Thank you, sir.
Bye-bye. And congratulations to the awardees as well, Mandeep. I shouldn't forget.
Yeah, thank you.
Congratulations to the awardees. That was wonderful, fantastic award.
Yeah.
Langar for zero hunger.
Yeah.
Fantastic.
Yeah.
Terrific. Great slogan. Cheers. Bye.
Thank you all
Bye,
the
folks.
panelists.
Bye.
Thank you.
Thank you, Sarji. It is a really wonderful efforts by you. Congratulations, Dr. Udayji.